The state needs more help on the front lines. An executive order from Governor Hogan may help with that. How this new measure could give a new influx of talent to our healthcare system.
And we're getting more positive signs for tomorrow afternoon's football game between the Ravens and the Steelers. The players coming off the COVID list for Baltimore.
Catastrophic. It's how Baltimore County Superintendent described the ransomware attack against his school system. But in less than 24 hours, students will be virtually back in class. How the restoration efforts are going tonight. All right, 56 more Marylanders in the hospital tonight, and our nurses and doctors really are feeling the strain.
Yeah, nearly 1,600 people with the virus are now in hospital. That's the highest we've seen since May the 12th, and it's approaching record levels that we saw back in April. 350 of those patients are in intensive care. And Governor Hogan is, of course, offering some new measures, and he can add some relief to those on the front lines.
Yeah, less than an hour ago, he issued a new executive order to strengthen frontline staffing. WMER2 News' Jeff Hager live in Annapolis tonight with what the order could mean for our hospitals. Jeff?
Well, Kelly, making sure that there's a hospital bed available for every Marylander who needs it. That's the governor's goal, and he announced steps today to try to ensure that. The governor says today there are already 21 hospitals around the state which have exceeded 90% of their capacity. In a very public appeal, he's gone out looking for anyone who can help, including school nurses, people with clinical backgrounds, retired healthcare workers, and even is looking at taking medical students interested in earning academic credit to try to help the overworked frontline health workers who are working multiple shifts today. One of the state's latest victims put a somber explanation point on that need.
Sadly, we have lost our youngest victim, a 1-year-old boy, to this deadly virus. We are laser focused on taking actions in an effort to prevent the overburdening of our healthcare system.
Right now, if you take COVID patients plus patients who are hospitalized with other needs, there are currently 6,800 beds that are filled out of some 8,000 here in this state. That's why they're estimating if they get another 2,000 COVID patients in the next few days, they may need as many as 2,000 to 3,000 more healthcare workers. Reporting live at the State House, Jeff Hager, WMAR2 News.